Good afternoon from Kansas City, Missouri. Now it's 3:53 p.m. in Central Time. And as always, I always introduce myself first before we go deeper. First, my name is Ming. Many of my friends, they when I was in China, many of my friends they call me full name is which is Zhongming in Chinese. Since I got to the since I came to this country back in years ago, I many local people call me Ming for short, and you are more than welcome. You are more than welcome to call me Ming for short. And time flies. Since I came to this country, and for the first few years, life wasn't easy. Were not easy, and then years later, back in 2016, I started I finished, I graduated from the massage therapy program as the licensed massage therapist. Initially registered in Pennsylvania. Then then I moved to Kansas City a year, actually just a few months later. Now I talk about the reason behind of the massages. You know, I choose massage as my as a as my career. It's a down. It's There are some reasons because of the many of you, as I just probably some of you read my descriptions listed below. I wrote it a moment ago. Massage therapy actually it's not only just actually it's two parts. Massage is a mind and body connection, and because we all know we have a physical body that we can see, and also we have mental that we cannot see, but we experience that. Basically, everything everything in this world on this planet only got down to only two things: matter and energy. That sometimes when we receive massages, we feel that feeling good sensation, and that's the from the physical touch that that you experiencing during the professional massage. Then they when you and and then you're feeling good because the massage is basically it's like in my words, I can tell you that it's like soft tissue manipulation. Many people they said, my clients they came to me. They said, "Oh, Ming, can you adjust my back, crack my back?" And well, and if I be a person, everybody can do that. Even for yourself, you can do that as well. And there are so many videos on YouTube. You can YouTube it, such as how to crack back, and by myself, and they have a lot of tutorials on YouTube. And I'm not suggest to do so because the well, it's people are different. In my opinion, safety is always number one, and nothing is more than important. Nothing is above the safety. That's I always get my. Uh, did I crack my back? Sometimes but it's in a casual way, such as I practice yoga with one of the local personal trainers. Her name is Jennifer Shelton. Woo! Yeah, she's my coach. She's my yoga coach. I practice with her for yoga classes since 2019, and the reason I always follow what the guidelines from the professionals because they know what they do, and that's the back to the question we just talked about. When you when we practice, the many of my clients ask me whether I can crack their back. Um, in in my massage as a professional massage therapist, my answer is no. I cannot do that because that is out of my scope of practice. It's unethical to do so. And on the other hand, the I don't recommend you to do it by yourself or just because the as I just mentioned, we have a different comfortable levels, and some people they feel very comfortable. They can do that, and some tutorials is I always follow the tutorials, such as recipes to give me more ideas, more ways of cooking food, cooking nutritious food, but not tasty, but not only tasty, but also a very nutrition dense type of food, and they give me that type of ideas. That's the it's quite different compared to the the spinal vertebral adjustment. Uh, that's my personal opinion, and that's my always I said it's out of my scope of practice because as a massage therapist, and it's unethical to do so. Then when I giving massages, and I found there are major two groups of people who needing massage the most. The one group of people they need massage that related to the it's more related to the stress induced type of a clients. What I mean by that is many of some of the I can say 40 yeah 40 30-40% of my clients they came to see me because of they looking for a relaxation type of massage, and probably some of you know that already. It's a very classic massage. It's called Swedish massage. It's a very soothing, gentle, kneading, petrissage, and effleurage, all this type of techniques, but with a gentle way. Um, the science behind of the muscle manipulation and also the behind the Swedish massage is that Swedish massage is so soothing. It's rhythmic, and also it's quite slow. That type of feeling could make you to promote the blood circulation. But what blood circulation is probably for just for your reference in our circulatory system, circulation system. We have two two the blood vessels, two major blood vessels. They are the artery, artery, and the other called vein, uh, uh, blood vessels. And the massage, and especially Swedish massage, address the to promote blood circulation only apply to the venous vein, the venous blood circulation. Basically, it's we push the blood because of the gravity, and when we're standing up, and the blood, the gravity against us, and we have a pulling force that's down to our feet. So that's why some people they have some called peripheral venous disease. It's called the PVD. They have some type of varicose vein because of the blood trap, and the because of the valve in the vein, in the blood vessels, in the is damaged or inflamed, it's not working, then causes the blood pool. And that's why massage is a very good. Massage kicks in and trying to push the blood back to heart, because we all know the we need blood to deliver, to transport, not only the gases such as the oxygen, carbon dioxide, right? Also, we needed to deliver nutrients and and also to transport the metabolic waste back to the back to the the heart, and then send it out, and send it back to lung for the pulmonary circulation, right from the pulmonary artery, and send the deoxygenated blood to the lung, and then they have the gases exchange. Let's say like the oxygen and the carbon dioxide, they exchange. Then it's back through the pulmonary vein. That is back to the left ventricle. Then left ventricle. Let me take a look. Left atrium. I'm sorry. Left atrium. Then through the left atrium, then to through the mitral valve to the left ventricle. Then the ventricle contract, send the blood for the systemic blood circulation that deliver the oxygen and deliver nutrients, and because of the artery is the major the big major blood vessel, then it's getting smaller. It's called an arteriole. The arteriole it's getting smaller, become the capillary bed, and then become a capillary. But then in that capillary bed, and that is because they have a different pressure, like a hydrostatic pressure is pushing out, and also they have a uh, colloid pressure, that is to suck the gases and the nutrients and the metabolic wastes, not the nutrients. Actually, it's the metabolic wastes, and back in, and then the went through to the capillary bed, and then back to the back to the venous, and then venous is the smaller than vein, and then back to vein, and then vein through the, depends on the region, whether it's from the upper of whether it's on top, or it's on the or it's the below the heart or above the heart. Then it's the blood is sent back to the major vein, that is called superior and the inferior vena cava. Then back to the right atrium, then right atrium through the tricuspid valve, and to the right ventricle, and right ventricle contract, send the blood through the pulmonary artery, and then to the lung for the pulmonary circulation. Then the process restart again. That's the circulation, and then the many people, some of my clients, they just they just oh they kept asking me, and why why people could feel relaxed after massage. Very good question. uh, because personally, I get a massage usually in about 1 or 2 weeks. Sometimes it depends on my friend's schedule, and sometimes I get massages in just a week, or sometimes, well, I try to not go that far. Try to not go over a month. Minimum, maximum 3 4 weeks. That's the maximum, because I'm a massage therapist. I giving it's quite a physical demand job. That's one thing, and the other thing is massages is it's nurturing my body and my mind. So the answer, and the answer to the question that I just mentioned. Why massages uh, is could make us feeling so good? It's not only because of the blood circulation that it promote the venous blood back to the heart and for pulmonary circulation. The other thing is because the when we push the blood back to heart, then to the liver and to the blood is to reprocess. But what are in the what are things in the blood? Basically, there are some hormones, right? And then there are some the like white blood cells and red blood cells and buffy coat. Basically, the it's and plasma and all these things and become the blood made of made blood. Then the other thing is in we all live in this world. This world is I personally I don't think I never at least so far during all these years in my life, and so far I never heard anybody told me they never had a stress, such as they said, "Oh, yeah, no stress." So could you tell me the definition of the stress is? Or I never experienced that. No depression, no anxiety, no worry, no anger, no irritation, no um, no, just happy every day, and uh, that's not a true statement. And then here's the thing: when we stressed, we have a two type of stress: acute stress and the chronic stress. Acute stress basically such as is quite a short life. When when it's happened, it's only uh, just live in about a few hours, maybe a day or two, and then you feel better. You such as the this acute stress, acute stress examples like you maybe just maybe have an argument with someone, like maybe your friends or maybe your significant others, because of something. I said, "Oh, why you pay why you lost why you don't pay special attention so that you will not lose money, for example." Okay, so here's a very good example. And then you said, okay, you blame yourself and probably you didn't feel good, and you felt you felt just uncomfortable. Well, it's okay, but it, the then the first thing you experiencing that is our adrenal gland. Basically, it's in the cortex layer of the adrenal gland release the one of the hormones. It's called cortisol. Cortisol hormone released and into the bloodstream, and then we have that, and then we the one of the nervous response. It's called the autonomic nerve response. It's called the fight, flight, or fright response. Probably some of you heard that is fight or flight or fright response. Basically, it means you are ready for something. You are either ready to fight the the stress situation, or you need to run away. Uh, Basically, that's how it works. Then this symptom kicks in. The this we call the sympathetic nerve system kicks in, then have some the some psychological, some it's like a physiological behaviors, such as you can people who's experiencing sympathetic nerve system, their pupils dilate, because once their pupils dilate, it's basically they can see more things, more light came into your light to your eyes, and then you can see more things around you. And then the other thing is your bronchi. Your bronchi, the it's not constrict but relax, because once your bronchi relax, and then the diameter is getting bigger, then more air get into lung. Then then the more air is into lung, and our to and we can just have more energy, right? When we breathe more air, and then because in the traditional Chinese medicine, and now I read a year ago maybe, that talk about the air, the oxygen. Actually, it's not talking about a specific oxygen, but they talk about the air. The air pushes the blood. No air, the blood will be still. And then basically, once the blood becomes still, and then it also means no life. So basically, we need to breathe more. And also lately, I read one of the books written by the James Nestor, called "The Breath." It's one of the books. It's really good. I recommend you to read it if you, because it's one of the New York bestseller books, and I read it. It was really good. I learned a lot about sleep apnea, but we'll talk about more maybe next time. Then all this and also because of the sympathetic nerve system initiated, then the other things could trigger as well, such as the blood in our superficial layer of the body, and get into deeper. So that's it's to get because it's once we got a cut, or maybe get the scratches and all our superficial layer, and during fight, or maybe during escaping from the threat, we will not bleed to death. And other things such as our digestion system. So stomach is not working, is inhibited, and basically during the fight flight sympathetic nerve system, the stage, and we don't. Probably you experience that when you are when you just had a fight, or you had arguments, or maybe you were unhappy, angry. Probably you don't have you don't have a good appetite. You don't want to eat a lot of food. Probably it's time for dinner, maybe time for lunch, and but just right after the sympathetic nerve up the initiated, you don't you shouldn't have a good appetite, because of the our cortisol, that is a hormone, and inhibit the inhibit the digestion system. And also the other thing is quite interesting is the sympathetic nerve system, once it's initiated, and also suppress our immune system. Basically, it's like a leukocytes, and they have that's many people said the even in China, and we had the quite a old saying in Chinese, and people talk about the such as just how can I translate that? Basically, it means don't be angry, because angry will hurt your body. Back then, when I was a kid, and I was thinking, and why angry could hurt my body? How it hurt my body? Basically, it's but now I know it's not. It is hurting my body, but it's not the stress situation. It's not the stress situation hurt my body because of the cortisol, the hormone that release in the blood into the blood. That's a blood into the blood. Then the it's a inhibit the our immune system. Hey, immune system is like a great wall, or maybe like a bubble around us. But once that bubble is a burst, basically we are prone to the infection, right? And that's why I still remember. And the I was yeah, maybe, yeah, at least personally I can say when I was in China, and I was pretty sick. Probably I didn't I didn't I didn't understand all this word, the deep meaning of these words or old sayings. And but now when I'm getting older, and then I realize, okay, they said that anger could hurt your body. I said, okay, actually it makes sense, because that's the sympathetic nerve system inhibits our immune system. That's why the it's all this responses caused by the cortisol, and also the other thing is on the on the deeper layer, cortex, and what's the other layer? It's called they release another two hormones. Basically, it's called epinephrine, or epiadrenaline, adrenaline, or and noradrenaline. These are two hormones. These two hormones, they have their functions. Basically, to increase heart rate, and also to constrict our blood vessels. Think about that. And the water hose, the diameter. If the diameter is getting smaller, what happened is the the pressure, the pressure of water is squirt longer, right? Because of that's also called the what's called the resistance. Is it like a cardiac output, and the times resistance systemic. I'm sorry, I forgot. But these basically there's a formula to measure the to measure the heart, and yeah. So a lot of the physiological responses related to it. But the massages, because the simply push all this the venous blood back to the heart, and then the after reprocess, such as a reprocess, especially by the liver and the kidney, and also spleen, and once they reprocess as a hormone. They process cortisol, and also the noradrenaline, adrenaline, also called norepinephrine, epinephrine, to reprocess all these hormones. They then their content in the blood vessels is reduced. That's many people I noticed, and I noticed that, and uh, a decent amount of people, a decent amount of my clients after massages, they use bathroom. They use bathroom. and even some of them they use bathroom during the session. Not only they drink too much water, maybe, but also because of the liver to reprocess all these hormones, and it become and then become the water soluble, and then it's and then and send it to send it to liver, and then send it to the liver, and then to because of the loop of Henle and all this distal convoluted tubule uh, to the final destination. It's a collecting duct, and and then pee it out. Uh, let's see. The one of the things is people get massages is have it's they getting like relaxing massages. It's just the feature the feature massages name is called a Swedish massage. Have a significant. It's also a scientific proof that the this technique is is good for stress reduction, and we'll talk about more. Let's see whether it's today or tomorrow, and I'll keep doing some live the live the videos like this to share more things that could help people who watch the my videos. So that's I hope you can you have a you can enjoy your life more, and enjoy your life more and the pain less. That's my goal. All right. Thank you so much for watching, and stay and have a good day, and I'll see you soon.